Thousands of hospital operations have been cancelled ahead of a threatened strike action by allied health workers next week. They've been negotiating a new collective agreement for the past 18 months, but with no pay offer from the DHBs, they'll walk off the job for 24 hours on Monday. PSA organiser Will Matthews is with us this morning, along with Steve Grant, who has worked as a sterile services technician for 12 years. Good morning, guys.
Morning.
Thanks so much for being with me this morning. Well, I'm going to start with you. Tell me, the DHB's had a certain time frame to get back to you with a renewed offer or some negotiating. They haven't been playing ball.
Yeah, so look, it's been 18 months, like you said, since we started negotiations. It's been 2 weeks since the Employment Relations Authority released recommendations on how we can resolve the dispute. It's been a week since the DHB said they would get us an offer this week. It's Friday now, and they failed to meet that commitment.
OK, so, well, they could get you something today.
Yeah, look, I mean, it takes more time than just a day to call off a strike of 10,000 health workers.
So this is going ahead?
It's going to take something pretty drastic now to call these strikes off. We're well past the 11th hour.
OK, so your message to people who might be affected by this next week operations is it's happening? Yeah,
look, the DHBs have failed to meet their commitment to us, and unless something drastic changes, these strikes are going ahead.
Have they said to you, oh, no, hold off, guys, just give us till Sunday, or, you know, give us... What have they said anything to you?
We've been given deadline after deadline, not only for the last 2 weeks, but for months now, and we've had enough. Our members have had enough, and the trust that they have in their employers has been shattered.
You've got 10,000 members who are going to be walking off the job. That's a lot of people. And tell me what types of jobs they're doing.
We've got over 70 professions in this workforce. So that ranges from sterile sciences technicians like Steve to people like alcohol and drug clinicians, social workers, dietitians. So they are at the core of our health system and our response to COVID-19. And they've been overworked, underpaid and undervalued for far too long. OK,
I want to bring Steve in now. Steve, welcome to the show. Nice to have you here.
Morning.
Steve, tell me what your pay and conditions are like at the moment.
Yeah, so our pay for my services is very low. We're one of the lowest paid departments in the hospital, along with quite a few others. I've been in the DHB for 12 years. I'm just making $25.40 an hour, where a shift supervisor at KFC makes $27 an hour. So, you know, it's pretty, our pay is real low. The last rise in the minimum wage increased, and therefore the two bottom steps in our salary scale became illegal. So now we've got staff on the minimum wage doing a very important job.
Yeah, what is that job, so people know, Steve? What do you do?
So we reprocess all the medical equipment and all the instruments used in theatres, and basically make them ready for the next operation, make sure that they're not going to infect the next person that get used on, and make sure they're working properly.
OK, so the instruments that are put inside us during operations, you're paid less than somebody who works at KFC?
Yep, for a manager that works at KFC and for people on the top of the sterile supply scale, get paid less than KFC, and our trainees get barely above the minimum wage. And my department's running on 50% trainees at the moment with less than a year's experience.
Steve, is that enough to get by on for you every week?
Not really. I work a second job to get by on, and a lot of other people in my department jump at any overtime we have. So they end up working 6 days, 7 days, just to make ends meet. And the DHBs rely on us, and they rely on our goodwill to fill that overtime. But that's gone. That's gone now.
How many? Do you still do the overtime even though it's not paid?
No. Where the trust is gone now, and we won't be doing that overtime.
Got you.
Because they've just ruined it. Any goodwill we had to do those overtime lists, we're just like, no.
12 years.
We've had enough.
Steve, 12 years. You've never seen it this bad.
No, definitely not. You know, we can't recruit or retrain staff because of the money. It's not the working conditions, it's just the money. You can go and get more money at other jobs, and people need money now. So that's what it is. And, you know, just being treated this way by the DHBs is terrible.
Where's your second... You said you had another job. What do you do?
I work security in a bar.
And does that pay more than the hospital job?
An hourly rate, yes.
OK. Steve, how many people are in your team? And how many do you need? Like, what would you be short by, do you think?
So my DHB, we are budgeted for 23 staff, and we have 13. And out of that 13, 6 of those are trainees with just on a year or less experience. So you've only got 6 qualified staff.
Steve, thank you very much for talking to us this morning. We really appreciate your time, mate. That is Sterile Sciences Technician Steve Grant this morning. What's your message to the DHBs then? So you're going ahead with the strike action on Monday. People who have operations will be affected, but Steve's the reason you're doing it. What's your message to the DHB today?
Well, look, frankly, it is unbelievable that we are now at this stage after 18 months. And our message, not only to the DHBs, but the Ministry of Health, is that 6 weeks out from generational health reforms coming into effect on the 1st of July, they need to consider what they want their legacy to be. Is it those generational health reforms, or is it being badly exposed on their treatment of the same workers who have just shepherded us through 2 years of a COVID-19 crisis?
Good point, because one is a thick layer of bureaucracy in Wellington that's been created.
And one of the people who have been coming to work every single day to keep us safe.
Thanks very much for your time this morning. Will Matthews from the PSA.